Well, the South African Medical Research Council has detected the COVID-19 Delta variant in wastewater in the Western Cape, but the viral fragments are said not to be infectious. To explain what it means, I'm joined now by the Council's Director, Angela Mathee. Thanks for your time. We appreciate it. So many would be concerned about this discovery. Just take us through what you found.
So there's no need for anyone from the general public to be concerned. In our surveillance program, the MRC has been undertaking tests in wastewater or in sewage plants since July 2020 to be able to give public health sector an indication of whether the SARS-CoV-2 concentrations are low, high, rising in the wastewater treatment plants. And that is valuable information because we can usually pick up SARS-CoV-2 concentrations in wastewater about a week or two before you pick it up through community testing. So we've been doing that for the past year. For the past 2.5 months, we have been doing variant testing. And we've been able to look for the alpha and the beta variants. Last week, we were able to take delivery of the reagents required to also look for the Delta variant. But throughout all of those aspects of our program, we are not looking at live virus. We are simply collecting the remains of the virus. In fact, we're collecting, as you said, the genetic fragments of it. So there's no live virus to cause infections from wastewater. We are really just picking up the genetic material and we are isolating and quantifying that.
Is there any way of this ending up in our taps?
No. I mean, there has been many studies undertaken throughout the world, and there is no evidence to date that wastewater, that the virus remains viable in wastewater. And at any rate, there should be no opportunity. If our systems are functioning properly, there should be no opportunity for wastewater to enter our drinking water system.
All right, so let's move on to the COVID-19 numbers that we are seeing. Of course, we were very optimistic just the other day about a decline in infection rate, but things seem to be increasing again. Is this something we should be worried about? Are we going to see a decline in this number anytime soon, do you reckon, given the lockdown in the past 2 weeks?
I'm afraid I'm not involved in the case data. My project relates specifically to the wastewater. What I can say from the wastewater side is that we have been picking up for weeks now increased volatility in the concentration of SARS-CoV-2 in various parts of the country. So that is a concern. It does point to the fact that there's an increasing number of people with COVID-19, either symptomatic people who are actually going to health facilities for testing and for treatment, or people who have COVID-19 but they're completely unaware of it. So there is that risk, and that's why when we discovered the fragments of the Delta variants in the wastewater, we put out a call encouraging people to really now be stringent about the non-pharmaceutical interventions. In other words, it's never been more important to wear masks, to keep at least 2 meters away from other people, to avoid social gatherings, and to be very, very stringent and meticulous about hand hygiene.
All right, thank you so much for your time and your insight. Appreciate it. That was Director of the South African Medical Research Council, Angela Mathee.